Do you struggle with shoulder pain when you try to lift your arm above your head or behind your back? Or when you're trying to sleep on your side? You may have been told it's a rotator cuff tear, impingement, tendinitis, or even arthritis. But here's the truth. Most shoulder pain is not caused by shoulder damage. It's caused by an increase in sensitivity, possible weakness, also likely some stiffness, but most importantly, a lack of overall movement. So in this long and detailed video, I'm going to show you my most proven ways to stop shoulder pain using a combination of some hands-on massage techniques and some proven physiotherapy exercises. I'll also be sharing lots of important facts about your shoulder pain and also some self-massage techniques. So make sure you save this video or send the link to your email or WhatsApp so you can continue watching it when you have time. So by the end of the video, you'll understand exactly what to do, what not to do, and why so many rehab plans often fail. This video differs from many other videos on rotator cuff treatment here on YouTube because it contains some special massage techniques that can help to reduce pain quickly. So leave a comment and let me know which one you found the most helpful. So let's start with what's happening in your shoulder. Please remember this is an educational video and not medical advice, however, we hope it helps. Now back to the shoulder. Let's talk about the rotator cuff muscles. They're an important group of muscles which stabilize the shoulder. You can see the 4 rotator cuff muscles showing on the screen here. The supraspinatus, the infraspinatus, teres minor, and subscapularis. They're small but incredibly important. They keep the ball of your shoulder centered in the socket every time you move. Now, when shoulder pain kicks in, it's rarely because these muscles are torn or damaged. In fact, research shows that many people over 40 years of age have rotator cuff tears but no reported pain. So what's really happening with your shoulder and why does it hurt? Well, let's break it down. It's usually a combination of sensitivity, weakness, stiffness, and anxiety. Let's look at those now in a bit more detail, starting with anxiety. So if you've injured your shoulder, you're often worried about what the cause of pain could be and whether or not you've damaged anything. And as a result, you tend to move your shoulder less and protect it. You also become hypervigilant of any sensations you get from your shoulder, and this can lead to an increase in pain sensitivity. Then if we consider stiffness, the fact you're moving your shoulder less is naturally going to cause it to become more stiff. And then when you do try to move it, the increase in sensitivity plus the lack of movement leads to both the feeling of stiffness and also some physical stiffness in the shoulder from lack of movement. And then if we look at weakness, you can understand why the shoulder muscles may become weak from lack of movement and lack of stimulation. And finally, sensitivity. All of the things I've just mentioned contribute to an increase in sensitivity around your shoulder. So there may not be any change to the structural situation in your shoulder, but the increase in pain can come from an increase in sensitivity of the nerves in and around your shoulder. So instead of trying to heal a rotator cuff tear or push through pain, our goal instead is going to be to restore optimal movement and increase the shoulder's tolerance of loading. Not only do I believe this is the best approach, but it's also an evidence-based approach to dealing with rotator cuff-related shoulder pain. So let's get started. So here's the part most people miss. Shoulder movement is actually a 2-part motion. Part from the ball and socket joint here, and the other part from the rotation of the shoulder blade. So when your arm lifts and your shoulder moves, the shoulder blade also has to rotate. And if the shoulder blade is stiff, it puts more stress on the ball and socket joint, and more stress on those rotator cuff muscles. So before we start the rotator cuff strengthening, we're going to check that the shoulder blade is not too stiff, because if it is, it's going to place more stress on the rotator cuff muscles. Next, I'm going to show you 3 techniques to help mobilize those shoulder blades. For the first technique, I'm going to massage down between the shoulder blades over the rhomboids and lower trapezius. I'm using a fairly dry wax. Here I'm using rock rub, and this is to stop me sliding over the skin too quickly, and it allows me to put more pressure down through the soft tissue. By keeping my arms straight and leaning forwards, I can use my body weight to make sure that I use a moderate and consistent amount of pressure as I move down between the shoulder blades. And I'll perform this technique for 1 to 2 minutes. Technique number 2, we're going to gently pull the shoulder forwards and back whilst providing counter pressure with the other hand. So as I pull the arm and shoulder blade towards me, I'm going to gently push the soft tissue back just underneath the shoulder blade there, and then pull the soft tissue towards me as I push the arm and shoulder blade back. So that's the side-lying shoulder blade mobilization. Technique number 3 is my patient's favourite, and that's the scapular mobilisation. So you put your lower arm between their arm and torso, and then your fingers on the lower border of the scapula. Then your arm uppermost near their head goes over the top of the shoulder and around the back towards the shoulder blade, and then that gives you a good grip of the shoulder blade. So that's the lower border of the shoulder blade. My fingers there and holding over the top. From here we can then mobilize the shoulder blade, as you can see, and move it around in circles. Now there's 3 moves you can do. There's this one, which is the circular motion or circumduction. There's also one where you pull the shoulder blade away from the spine, so you just pull straight up towards the ceiling. Okay. Then there's the other one where you lift the arm out to the side, pull the shoulder blade so the shoulder blade is rotating. So that's this one here. And you'll notice I'm moving my body in order to impart that movement through the shoulder blade. So movement 1, movement 2, straight up towards the ceiling, and movement 3, lifting the arm and rotating the shoulder blade. You can combine those 3 movements, or you may find that one is particularly favourable and focus on that. Perform this technique for 30 to 60 seconds. So 2 of the best exercises for the muscles around the shoulder blade are the push-up plus and the corkscrew. Let's start with the push-up plus. I'll demonstrate this exercise from the front and then from the side. So in the press-up position, which you can do either from your knees or in a full press-up position, so resting on your toes, I'm going to start on my knees and I'd recommend you do the same. You want to keep your arms straight and let your chest drop down between your arms so that your shoulder blades squeeze together. Now this is called the push-up plus, but another way of describing it is a straight arm press up, because if you watch me here, I'm doing a press up action as best I can without bending my arms. And this really works the muscles around your shoulder blade, especially the muscles called your serratus anterior. To begin with, I'd recommend doing this exercise for 3 sets of 6 repetitions. Now, if you're struggling with that push-up plus or straight arm press up, here's an alternative. Take a light resistance band, pop it around your back, put your arms out in front of you in that press up position, and then you can let your shoulder blades come back and then splay your shoulder blades apart. So you're doing the same action, but you've got a lot less resistance, just the resistance of the band. Obviously choose a light resistance band when you do this, and if you find it easy, then you can upgrade to a heavier resistance band or go back to trying those exercises in the press-up position. Next, we'll go through the corkscrew exercise. So lie on your back with your knees up so that you can put your pelvis and spine in a neutral position, and then also set your shoulder blades, so pull your shoulders back and down, and then place your body weight over them to hold them in place. Raise your arms up, and then rotate your palms upwards like so. As you do that, you should be pulling your shoulders back and down, and there'll be a bit of resistance from your body weight pressing down over your shoulder blades. And that is the exercise. So hands with your palms facing each other, rotate your arms, shoulders back and down, palms facing up, hold for a couple of seconds. I'd recommend doing this exercise for 3 sets of 10. This exercise can be made a little bit better by using a resistance band between your hands. So back in position, this time when you rotate so that your palms are facing upwards, the resistance band will stretch and give you a bit of extra resistance to the exercise. Don't forget to also pull your shoulders back and down momentarily as you perform the exercise. Okay, so we've just been exercising some important muscles, including the serratus anterior and the lower trapezius, both important muscles for keeping that shoulder blade moving. Let's move on to the next part of the video. In this next section, we're going to get the main ball and socket joint moving with some special massage techniques before we move on to the strengthening exercises. Okay, so let's assume that the shoulder is painful, but there are no serious symptoms and you've had a medical assessment, in which case we can move forwards and try these special massage techniques that target the rotator cuff muscles. Here are a couple of subscapularis techniques you can use. Find the back of the shoulder blade and then place your thumb in over the front of the shoulder blade there, onto the subscapularis muscle tissue. From there, you can then assist the arm up into elevation in a pain-free range whilst applying some pressure down over the subscapularis. By pulling the soft tissue down and moving the arm up, you can create some soft tissue tension between the arm and the subscapularis. Instead of using your thumb, you can just use the base of your thumb there, the thenar eminence, to apply overall pressure, lock the soft tissue down, and then move the arm up. Repeat this 3 to 5 times. You can do a similar technique from the side by placing your thumb over the front of the shoulder blade and then pulling the arm gently towards you so that your thumb sinks down under the shoulder blade. From here, gently mobilize the arm in small circles whilst pressing in with your thumb. Be careful not to overstrain your thumb and just perform this technique for 10 to 20 seconds at a time. To get to the supraspinatus muscle belly, we're going to go into the soft tissue over the top of the spine of the scapula, which is here, and I'll show an image on the screen as well. So with your outer arm, place that underneath their shoulder so that you've got the ability to move the shoulder, and then form a hook grip with your fingers and hook over the top of the spine of the scapula. Again, there's an image showing on the screen here. And that's your starting point. Now, there's a couple of things you can do here. The simplest one is just to press in with your fingers and provide some sustained pressure, what's commonly called trigger pointing, in over that area there. And this can help to reduce sensitivity and may help to reduce the shoulder pain, which is really helpful, especially before you start any extra strengthening exercises. A more advanced technique is to slightly raise the shoulder, apply the pressure with the fingers over the top of that spine of scapula there into that soft tissue, and then gently pull the shoulder away from the ear whilst gliding the fingers down towards the top of the shoulder. Okay, so an exaggerated version would be the fingers glide across here, but it's a small movement, so there, lock in place, and then drag your fingers out laterally towards the top of the shoulder. One more time. Next is the teres minor muscle. So we're going to bring the arm up into elevation to allow us to get some access to the back of the armpit, or axilla in medical terms. And we're just going to do some basic kneading around that area, which is where I hook my fingers and push with my palm to impart some pressure through the soft tissue. And that's a nice simple technique that you can do around the back of the armpit to start to loosen off some of that tension in the soft tissue. If it's painful to have the arm up in this position, then reduce it and perform the technique with less elevation. This next technique targets the infraspinatus rotator cuff muscle, where the muscle belly is found in the middle of the shoulder blade. So one of the easiest ways to target that is just some simple thumb rolling, and if you find any particular tender points, you may find it helpful to press and pause on those tender points for around 10 to 20 seconds, or until that sensitivity eases off. Once again, this is commonly called a trigger pointing technique. So that's the thumb rolling and the sustained pressure. One of my go-tos for this area is some decompression. So I'm going to use here a silicone pod to decompress the area, and that allows me to mobilize the soft tissue with a lift instead of a press. So pop that on with a little bit of vacuum, and then I can mobilize around in circles or pull away from the shoulder blade in order to do like a reverse trigger point technique. I'd normally only leave these on for 30 to 60 seconds to minimize the marking and maximize the treatment effect. We're now ready to move on to the rehab exercises. But before we do, some important things to remember. Shoulder rehabilitation programs can take 2 to 3 months to work, and you will need to reduce any significantly irritating activities or sports temporarily whilst this program is underway. And it's also important that I share with you that for rotator cuff related shoulder pain, surgery doesn't offer a quick fix according to lots of research. Okay, so that's all I need to tell you for now. Let's get started with some easy stage 1 exercises. Let's start with some easy stage 1 options. To increase mobility, you can do these table slides. Sliding your hand down the table using something that will glide and slide easily, and leaning forwards so that you open up the shoulder, and this is to help improve shoulder elevation by using your body weight and a bit of help from gravity. Slowly stretch forwards as far as you can until you feel a light stretch under your arm. At that point, pause and return back to neutral. It's okay to nudge into that resistance a little bit to see if you can increase your range of motion. It may also help if you take a deep breath in, followed by a slow breath out as you go into the stretch. Another popular exercise is the wall crawl. Place your hand on the wall and crawl your fingers up the wall to increase your shoulder elevation. Go as high as you can and stop. If you want to, you can slightly bend your knees and lean forwards to increase the stretch through the shoulder. You can also do some hand squeezing exercises, either with something to squeeze or just simply making a fist. When you do that, it activates the muscles in your forearm, upper arm, and also activates the rotator cuff in your shoulder as well. So it's a great way to get started. Just squeeze, hold for 6 seconds, and relax. And you can repeat that 2 or 3 times during the day as a great way to start to activate those shoulder muscles during this easy stage 1 plan before we move on to the more advanced exercises. So the progression from the hand squeezes is to do something which directly activates those rotator cuff muscles in the shoulder. And it's very simple. I'm going to show you how to do that right now. So start with your arm by your side and elbow at 90 degrees. We're going to start with this outward rotation, this external rotation. But we're going to do static muscle contractions, also known as isometric muscle contractions. That is where we push against a force, but there's no actual movement occurring. Here's the first one. So we're aiming to push the arm in this direction, but we're going to block it using our opposite hand. So we're pushing out against our hand, which is providing the resistance, and you're pushing out for 6 seconds. If you push with 100% effort, sometimes that can be uncomfortable. So if that's the case, just back off a bit and push with 80, 70, 60, or even 50% of your maximal effort. Sustain that contraction for 6 seconds. Okay, great. After that, we're going to go in the opposite direction. So that's pushing inwards, but blocking that movement using our opposite arm. So push in for 6 seconds. And then we're going to move on to the next movement, which is going to be pushing forwards. So again, block that from the front and push forwards, counting for the 6 seconds. And then we're also going to be pushing our arm out to our side. So a little bit different than the rotation. This is the outward movement known as abduction, because you're taking the arm away. So here, place your hand over the elbow, push out against the resistance of your hand for 6 seconds. Now, the last one is pushing back. So you can put your hand under your elbow like so and push back into your hand. That can work, but that's quite a strong movement that you're doing. So you may find that you're overpowering your opposite arm. If that's the case, then simply find a wall or door frame that you can push your arm back into and push against that resistance for 6 seconds. Now, if you complete that routine, you may notice that the pain and sensitivity in your shoulder actually reduces quite quickly just from doing those few exercises. You can do 2 or 3 sets at a time, so that's 2 or 3 sets of 6 seconds, and it's a good idea to do them 2 to 3 times during the day. So that's quite a big commitment, but hopefully if you find that those simple exercises make your shoulder feel a bit better, you'll be more motivated to do them on a regular basis. And they're a great starting point for getting going with some more dynamic, larger range of motion exercises. Just a quick note on pain during the exercises. It's generally agreed that some discomfort or low levels of pain in the region of 2 to 3 out of 10 is acceptable during the rehabilitation exercises if the pain settles quickly after you stop. However, if the pain lingers, if you get aggravation and pain at night, or if there's an increase in pain in the morning, then it's indicating that you may be doing the exercises with too much intensity or maybe too many repetitions, and you should reduce those whilst the sensitivity of your shoulder continues to reduce. So it is okay to do some exercise in the presence of some pain, but it's not okay to just exercise in the presence of pain and aim for a no pain, no gain approach, because this can actually backfire, make your shoulder more painful and increase the soreness and sensitivity. On the other side of that though, if you don't do any exercise because of discomfort and you're waiting for your shoulder pain to completely go, then unfortunately as a strategy for managing rotator cuff related shoulder pain, this rarely helps. It leads to the problems we talked about earlier, which is the increase in sensitivity, the stiffness, the weakness, and of course the anxiety around movement. So you need to work carefully, understanding and accepting low levels of pain, not trying to push into it too severely, but also not completely backing away from any movement that causes discomfort at all. I hope that makes sense. Remember, this is a general educational video, and if you have any uncertainty surrounding this, then make sure you consult a health professional face-to-face to get some personal guidance. In this next part of the video, I'm going to help you choose the best exercise for your shoulder. Now, there's three things we need to consider. The first one is we need to find the movement which you find most difficult or painful and target that as your rehabilitation exercise. Then we need to add some resistance, and then I'll show you a way of performing the exercise which the research shows can be one of the best ways to reduce pain and experience the least discomfort during your rehabilitation. So firstly, the movement that you find the most painful should be the one that you choose for your rehabilitation exercise. This avoids a lot of random exercises and can save you a lot of time. Let's look at three common movements which people usually find most painful. So movement number one might be outward rotation of the arm. That may be painful or weak. Movement number two is an outward lift of the arm abduction. That's often painful, and that might be the movement that you want to look at. But another common one is the inward rotation and putting the arm behind your back, which of course you commonly do when you're putting on a jacket. So you put your arm in and rotate, into the arm, into the sleeve, rotate, and then putting your arm around your back like that. A lot of people really struggle with that movement. If that's you, then that movement is going to be one which we need to focus on for your rehabilitation, because it's pointless doing other exercises if that is your troublesome movement that you need to do on a day-to-day basis. The next thing you want to do is add resistance, and this is most easily achieved using a resistance band, which are great for shoulder rehabilitation. There's loads available online, and they're usually pretty cheap, and they usually come in different levels of resistance. So you have a choice and some ability to progress as you rehab. So with outward rotation, you could simply hold it in the opposite arm and rotate with the resistance, okay? With the abduction, again, you could just hold it by your side and then lift the arm out with the resistance. With the lifting to the side, the abduction, I can simply stand on the resistance band and then perform the abduction exercise. For the arm behind the back exercise, you could pop the band over the top of a door. So people commonly tie a knot in the top, pop that over the door, close the door, check that it's secure, and then you can use that for your arm rotation and extension exercise, just like you were putting the jacket on. Now we can also look at the way you do the exercises. The research suggests that if you just do the controlled lowering or the controlled return back to neutral, this can help you to achieve the exercises with less discomfort and possibly get faster results. And this is called performing the eccentric movement, but not the concentric. Let me explain that a little bit further. I'm going to explain it doing this lifting abduction exercise. So when I lift the shoulder up with the resistance, my shoulder muscles are shortening and contracting. That's called a concentric contraction when the muscles shorten. Therefore, when I lower my arms slowly under control, the muscles are lengthening under control, and that's called an eccentric contraction. Because if I lifted the arm there and then just switched the muscles off and let go, there's no contraction and the arm is simply dropping down. But I'm not doing that. I'm coming up under control, that's a concentric contraction, shortening, and I'm going down under control where the same muscles are lengthening under control, and that's an eccentric contraction. Now, the reason I'm telling you this is because if you focus on just that controlled lowering of the movement, the research indicates that that can be more beneficial when you're doing your shoulder exercises. Now, the reason I'm telling you this is because the research shows that if you do the controlled lowering, the controlled eccentric contraction, that may lead to better results when you're doing your shoulder exercises. So there's a little bit more technique involved, but if you're struggling with the amount of resistance or with pain and discomfort, it may be worth trying to just work on the eccentric. So the way you would do that is use the other arm to lift up into the position and then slowly lower down with the resistance. Okay? Bend the elbow, lift up, out, and slowly lower down under resistance. So it's the lowering under resistance that you focus on rather than the concentric. It's not wrong or bad to do the concentric, and in fact, most of my clients would typically do both concentric and eccentric. But for those that are particularly struggling, and that might be you, I would recommend just focusing on the lowering under control phase to begin with until your shoulder feels less sensitive, less painful and stronger, and then you'll be able to progress to both the concentric and eccentric. I hope that wasn't too complicated. It's just about two types of muscle contraction and focusing on just the eccentric lowering under control phase to potentially get some faster results, particularly if you're struggling. Okay, so that was that one. If we take this one, the external rotation, that's going to be the concentric, and then that is the eccentric. So therefore you'd start there, add the resistance, and then slowly come back. Okay, again, start there, add the resistance, and slowly come back. That's an option for doing just eccentrics with that exercise. So here's how it would look for that rotation exercise that we were doing to help you fit a jacket without pain. So the concentric would be the contraction where you're going into that position, and the eccentric is where you come out of that position under control. So therefore, if you just wanted to do the eccentric, you could bring your arm into that position by using the opposite arm to take away the resistance, and then let the resistance come back by letting go, and then slowly coming back to that position, okay? Pull the resistance through, start in the start position, and then bring your arm back through. So it can involve a little bit of skill to just focus on that eccentric, and you may not need to, but as I said, if you're struggling with pain or discomfort, then start with the eccentrics. Now, before we move on, you're probably wondering how many of these exercises do I need to do? Now, rather unhelpfully, there's debate in the research about how many repetitions is beneficial, but actually you don't need to focus purely on how many repetitions you do. The most important thing is that you are doing them and doing them regularly. How often? Well, at least every day, and even 2 to 3 times a day. We're not looking to increase strength at this stage, just to increase function and reduce sensitivity. So little and often is best. So I'll say to you at this stage, do 30 seconds of the exercise 2 to 3 times per day. If you want to do more, then go ahead and do more. But remember, if you get significant lasting soreness afterwards or pain the next day, then it means you may have done too much. If you don't, then it means you could possibly do a bit more. Now, moving on, the next progression is not about doing more exercises or more reps. It's about sticking to the same exercise, but starting to add resistance. And the aim here is heavy, slow resistance. So a heavy resistance for you and a slow controlled movement. So I'm going to switch now to using a small weight, bring my arm out to my side as far as I can, and then slowly back down. Okay, so it's the same exercise, but much harder than using the resistance band. I can feel a little bit of discomfort in my shoulder, but I'm going to move slowly and under control and see how that feels afterwards. Rather than counting how many reps I'm going to do, I could count how many reps I can do in 30 seconds whilst maintaining that nice slow controlled pace. So back to this exercise again, I'm using a much stiffer resistance band. The exercise is harder to perform, but I'm performing it slowly and under control. Extending the arm and rotating the arm and back. One easy way to increase the resistance is simply to double up your exercise band. So after demonstrating those shoulder exercises, my shoulder is now feeling a bit fatigued. So if you were to do them for a few weeks, you should notice an increase in your shoulder strength and more confidence and an improved shoulder function. This would then allow you to move on to the next stage of the program, where we have a look at some more advanced shoulder exercises. Let's get started. We're going to start with a press-up routine to strengthen the pushing action. So on a raised surface, a kitchen worktop would be ideal because it's sturdy and not going to slide away from you. Go into the press-up position, and then you can begin by performing half a press-up and back up. Perform a few of those, If that feels okay and not too difficult, then go ahead and perform a full press up all the way down and all the way up. Slow and under control. Just a quick top tip for you, you actually get a better workout if you do the exercise slowly because there's more time under tension in comparison to doing it quickly where there's a lot less time under tension and the muscle potentially doesn't have to work as hard. So move slowly under control, you'll get better results from these exercises. Okay, so that's the raised surface. Now we're going to go down onto the floor. Progress from the raised surface, go down onto the floor and perform the press up from your knees once again so there's not too much weight going through your upper body. You could do a half press up, and if that feels okay, you can do a full press up slowly and under control. Now you don't have to, but should you want to, you can go into the full press up position, half press up and a full press up. Now you may not need or want to do a full press up, and that's okay. I'm just showing you lots of options and progressions here to help you get back to your sport or activity. Next, you may wish to try this side plank exercise. So lying on your side with your knees bent up, then lift your hips up towards the ceiling so that you're taking weight through your elbow and therefore through your affected shoulder. So this is the half side plank, lifting up, torso in line and a space below my hip with the weight going down through my shoulder. Hold for a few seconds and down. To progress that, from that position, you can then rotate back and stretch up. Rotate through, back and stretch up. To progress that further, straighten your legs so that you go into a full side plank with the legs straight, hold and down. To progress that further, you know what's coming next. Side plank, rotate and stretch. Rotate and stretch. Now I won't tell you how many reps and sets you should do of those because they are quite advanced exercises, as you can probably tell by the fact I'm a little bit out of breath now. So have a go and see firstly if you can do them under control, and if you can, try 2 or 3 repetitions. It's a good idea to do them on both sides as well, and then see how you progress from there. If you're struggling to do 2 or 3 under control, then stick with that exercise until you find it a bit easier before you then progress on further. These next exercises will improve our strength for the pulling motion. So using a resistance band or a weight, bend your knees and bend forwards, keeping your back straight, and then pull the weight into your side and release. And repeat that exercise until you start to feel a bit of fatigue in the muscles in your back. If you get past 15 repetitions and you're still not feeling any fatigue, then that would indicate that you want to add a bit more weight or resistance. Now, the other popular exercise for shoulder rehabilitation is called the lawn mower. So just imagine that you've got a pull start lawnmower and you're trying to do that action. So it's not just the pulling of the arm, it's actually the rotation of the spine as well. So I'm going to use the weight, start from my left foot, pull across my body, pull back and up to this position here. Okay, so the lawnmower action uses a lot more muscles and a much larger range of motion in comparison to the basic pulling action that we started with. And if you do a few of these, it'll get your heart rate up and get you breathing a bit heavier as well. As with all of these exercises, it's a good idea to do them on both sides. You may find it easier on one side than the other, but it's always good to have a comparison. And finally, strengthening this action, reaching overhead, is often very helpful because doing this in day-to-day life is usually required on a regular basis. So here I'm using the resistance band that we were using earlier, but at this stage in the plan we are looking to add a bit more resistance and to make things a bit harder. So I'm going to take the heavier weight that I've got here. This may be too heavy for you or even too light for you, but when you use a free weight like this, it will test your stability and further strengthen those rotator cuff muscles. And before we move on, just remember our discussion about pain. It is acceptable to have a low level of pain when you're exercising levels 2 or 3 out of 10, for example, but the pain should settle quickly afterwards, not cause ongoing discomfort at night or pain in the morning. If these things occur, you're probably doing too much and it would be advisable to get a face-to-face medical assessment. In this next section, I'm going to show you some stretches and home massage techniques that you can do to help reduce your shoulder pain if you don't have anybody to help you with the massage. So here my model is doing a neck stretch by placing the arm over the head and stretching through this side of the neck. And of course, it's a good idea to do both sides, holding each stretch for 10 to 20 seconds. If it feels good, then hold it for a little bit longer. This is a great stretch to do, the chest opener. Interlock your fingers, hands behind your head, and then open your elbows, pulling your elbows apart, and this will give a good stretch through the chest and help to increase your shoulder mobility. Perform this stretch for 30 to 60 seconds, moving slowly in and out of the chest stretch position. The chest stretch can also be performed from the side in this book opener exercise because it looks a bit like you're opening a book as you open up your elbows. So with this one, as you perform the stretch, you can also twist through your torso, which helps to not only improve shoulder mobility, but also mobility through the spine as well. Next, we're going to do an exercise which helps to stretch and mobilize the upper back. So using something to stretch over, I would recommend starting with a rolled up towel. You're going to place that just below the shoulder blades. So I'm going to position that there. Our model's going to lie back, hands behind his head to support his head, and he's going to lie over that rolled up towel, which is just at the bottom of his shoulder blades. So from this position, he lets his head go back, and that will stretch his upper back into that extension position. This next technique is called the ball on the wall, and it's as simple as it sounds. Place the ball between your upper back and the wall over the muscular areas. Then move your body around in order to locate the ball over any targeted muscular sore spots. When you find a sore spot, you've got a couple of options. One is to pause and sustain the pressure there like we did earlier with the trigger pointing techniques. And the other one is to perform some slow movements around that sore area by moving your body up and down or side to side. Just focus on muscular areas, as trying to massage the ball over any bony areas will be uncomfortable and will not lead to any helpful results. So just stick to massaging over those sore spots. This is a great way of self-massaging those difficult bits on your back, which often respond well to massage, but are very difficult to actually target yourself unless you have a therapist to hand. During the ball on the wall self-massage exercises, you may also find it advantageous to perform some shoulder elevation exercises during the massage technique. Next, I'm going to talk a little bit about advanced rehabilitation exercises. Now, these will depend on your aims and which sports and activities you wish to return to. The general advice I would give is to return to these activities gradually. Perhaps start with 10 to 20 minutes of the activity and then assess the outcome. Now, this is much preferred than suddenly participating in 90 minutes of tennis or swimming 100 lengths of a pool, for example, only to trigger a significant flare-up of symptoms, which is not only painful and inconvenient, but will also greatly reduce your confidence. So start with small amounts of activity, assess the outcome, and then build up gradually. So I hope this video was helpful. Now, here are the key points from the video. Most shoulder pain is not caused by structural damage. Sometimes it is, but it's more often due to sensitivity, weakness, stiffness, and a lack of movement. Pain often doesn't equal damage. Many people have rotator cuff tears, but no pain. The real issue is how the shoulder moves and how sensitive it's become. Effective rehab focuses on restoring movement and tolerance. It's not about healing a tear or forcing through pain. Mild pain during exercise, levels 2 to 3 out of 10, is acceptable if it settles quickly. Night pain or next day soreness means the intensity of the exercises was possibly too high. It's important to remember that rehabilitation takes time, typically 2 to 3 months. So patience and consistency are key. You should avoid quick fixes and don't return to full activity too soon. Unfortunately, recovery rarely follows a nice straight line, and you can expect some bumps along the road, good days and bad days. It's important to have an adaptable exercise strategy where you can perform easier exercises on the more difficult days and more advanced exercises as soon as you're ready to progress. Thanks for watching. Please give us a like and subscribe, and you'll find some more targeted videos showing on the screen here if you're watching us on YouTube. You've been watching the Physio channel. My name's Daniel Lawrence. We'll see you in the next video.